Hi, this is Ajay Minocha. I'm delighted that in my next episode of Apan Hyderabadi, I have with me a very ambidextrous technician, a very youthful looking veteran of more than 25 years of experience, a master at his table where he works with scalpels and gloves. I welcome you, Dr. Anuj Kapadiya, Senior Cardiologist. I'm delighted to have you.
Thank you so much.
At our show. Thank you so much. Anuj, let's start. You are a Gujarati. You still have roots in Gujarat or you're a Hyderabadi?
Actually, I'm the fourth generation in Hyderabad and we don't have anybody in Gujarat. In fact, to be very candidly saying, I've never been to Gujarat till now. And we've been brought up in Hyderabad. Parents have also been brought up here. My great-grandfather actually came in here and from there on we're here.
Right. So you're from Hyderabad Public School.
Yeah.
And then you did your medicine, obviously.
Begumpet.
Yes. So were you a front bencher, back bencher, bookworm? Tell us about something interesting about your school or college days.
Oh, that was, I think, by now, I think if I look back on my life, I think that's the most memorable part of my life. And I proudly call myself a HPS alum. And I was a decent student. Not probably the best in the lot, but not in the later half of the role as well. I actually was a cricketer for school. I used to open in the innings for school. I played under 13 state and then I was selected for this probables for state. And so I enjoyed myself in cricket. So more so I was there in cricket till my 10th class, after which I left to pursue my studies.
So since my channel is Apan Hyderabadi, I'll ask you in Hyderabadi. आप बहुत good looking हो, तो thank you बोलिए.
First of all, thank you. I won't put myself there though. But
Did you कभी सोचा था कि अगर डॉक्टर नहीं बना तो एक्टर बनूंगा, मॉडल बनूंगा?
I always wanted. If I was not a cricketer, I would have been a doctor. Is what I already wanted to be a cardiologist. Always wanted to be a cardiologist.
Why cardiology? Why not any other subject in?
Most fascinating, actually. It's so fascinating. It intrigues me even now. After so many years of practice, also it intrigues me, and I think you make an amazing difference in emergencies and all that to patients. You save a lot of lives. You make a lot of difference. So.
Was Care Hospital your first?
Yes, it was.
Innings?
It was.
मैंने सुना है कि you used to work round the clock. So is it true? And how was your innings at Care?
I joined Care 2006 and I worked like three days continuously most of the times because I used to be taking emergencies, used to be operating on acute heart attacks and there's something called as primary angioplasties which we used to do, and I was the director of the Cathlab there for the longest time, so everything was under me. So and at that point in time it was our responsibility to train, take care of the safety, and so there were a lot of amazing cases that we used to do, and it was a great experience. And I think that hard work has brought us here, whatever we are now. So
when I first heard of you, I heard of you as the new kid on the block. How was it working with seniors, and people actually used to call you the new kid on the block? Can you tell me a little on that?
I don't know that, but I'd still like to be called a kid. So the thing is, so I was the youngest guy who actually joined there with all these interventional skills because the others were already quite senior to me. So I was the first recruit after a long time in the Care setup, and I was the youngest by then, but I had taken over the Cathlab pretty significantly. I had started doing a lot of complex cases. So that's probably, I'm hearing this for the first time, but then that's probably the reason.
So you have done a lot of stenting.
Yeah.
So, और आप एक वर्कोहॉलिक भी हैं, क्या आप बताओगे कि कोई रिकॉर्ड आपने हासिल किया है या कितने स्टेंट्स दिन में किए या हफ्ते में किए, which went into your working hours also?
That is something which is very tough to say, but there are days.
What is the maximum number of stents you've done in a day?
Maybe around 20, 25.
20, 25 stents.
So There were days where we used to start operating at 3 in the morning and we used to end up at 11 in the night. And this we did for like almost 4-5 years.
Is that the trend all over the country?
No, nobody else does it. If I'm not wrong, nobody starts that. That was a culture with Care. And we, as a team, we had a couple of other of my colleagues. All of us actually, we were very in sync, most of us. So we all used to come in at that. It used to be a very nice, happy atmosphere. We used to be 6-7 cardiologists at the same time at 3 in the morning.
Wow.
Everybody there, including our DNB students, and we would be happily operating, chai coming in from an Irani hotel, having breakfast together, intermittently, continuously working in between. We were provided with a room where we used to intermittently nap there and then come back and continuously keep working after that. It was a crazy time, amazing time, good times which I have no repent for.
Right. I'll ask you a very, sometimes sad, it's a very personal question. Frankly बोलिएगा, जब आप OT पे होते हो और पेशेंट दम तोड़ देता है, कैसे लगता है?
See, these things happen and it becomes a part of our life. But I'll tell you some things. There are certain things where we know that eventuality is the end. That doesn't trouble us so much because life is finite. But there are certain things where you have a young guy and there are people who shouldn't die at that point in time, at that stage of life, or they were pretty close to us and nice people sometimes. Or there are people who have been associated with us for almost 10, 14, 15 years over a period of the years of practice. You get emotionally attached at some point, and that actually troubles you. And you carry that home also. You get a little disturbed with those things. And God does that balancing act where He'll make you do something really nice later on. And time heals everything. So
how do you unwind also?
Unwind, I love music, one, and I love sports. I still play sport and I exercise, I do marathons, so that way I unwind myself. Exercise is an integral part of my life and without which I cannot actually begin my day. So I finish off my exercise and only then go to hospital.
Another question, you have moved from Care to AIG. Do you find any difference between Care and AIG or it's just the same?
No. AIG has made a huge difference basically because they're very progressive. We have the best of equipment, probably nothing short of anywhere in the world.
Wow.
And well, I won't say nothing short, we are the best right now with all the equipment that is available anywhere else. And we do everything that is done anywhere else in the world. From doing regular stentings, to chipping out calcium, to using the best of equipment, to now we replace valves without opening the chest. We do surgeries without opening the chest. I think we ourselves have a common patient in between your friend and my friend too, who we replaced a valve which was rejected everywhere else.
Yes.
So, and he's doing extremely well now.
I know that, yes.
Yeah, so basically we are doing extremely complex cases now. We present in international conferences, we are heard, we are taken seriously. So these are things that are, this change has come in AIG because of the equipment that we have and the management also supports us significantly.
The reason I have a phone in my hand is that we are moving into a very interesting part of this interview. I am going to rapid fire 20 questions at Dr. Anuj Kapadiya. He's been extremely frank at whatever he has said so far, and I'm sure the same frankness and candid answers are going to come your way. Please enjoy the rapid fire. Sir, I'll go one at a time. These are 20 questions. So, how many years does smoking shorten life? Any advice on how to quit?
1/3 of your life is gone if you're continuously smoking. Yeah? And the best way to quit is cold turkey. You can't say I'll reduce and stop. It's never happened. I've never seen that happen. You just have to cold turkey. You just turn back and say I'm stopping today and you stop. We have medication that are available now. You have patches, there are nicotine patches, you have nicotine gums that help. And then you have counselors who actually help you in counseling as well. But I think at the end of the day, a huge chunk is from the family support. which also is very, very important. And you get irritable when you're stopping to smoke, you gain weight because your appetites increase. All that has to come by with a compassion from the family as well, to just keep pushing them. You quit for 3 months, generally at least 50-60 of them actually don't get back to smoking again.
What exactly is blood pressure? What is low? What is high? What is good? What is bad?
So blood pressure basically is the pressure which your heart generates and your vascular tone maintains. And normal is around 120/80 is what people say, but at the end of the day it's a 2 standard deviations in the whole population. So my blood pressures vary between 90 and 100/60. Some people may have a 130/80. So you don't have to worry that I have low blood pressure, he has high blood pressure.
Right.
Anything less than 140 and anything less than 90 is fine. And for elderly people, we push it up to even 150, 160, but the diastolic we keep it as 90. Diastolic more than 90 is bad. Systolic more than 150, 160 is bad. That will need treatment. Or if somebody then has other issues, they're getting symptomatic, that's when you say that this needs attention.
Cholesterol. What's good? What's bad?
Cholesterol, nothing in cholesterol is good, basically. LDL is called as the bad cholesterol, HDL is called as the good cholesterol. You should have a HDL which is more than 50, either sexes. The more the high HDL, the better. The lesser the LDL, the better. We have a cutoff of around 70 of LDL. Anything more than that is something we need to work on.
Walking, jogging, gym, or swim. What sort of people should do what? I mean, age के हिसाब से या build के हिसाब से?
See, swimming is an overall exercise, but problem is the availability of swimming pools, the cleanliness of swimming pools. These are issues that actually hinder people from swimming. But if you have an access to a good swimming pool, there's nothing like swimming. Second, jogging, walking, that is all suitable based on patient. Gym is all based on individual things, what is comforting. What I sincerely feel, I have done all of this, and then I have come to a situation where I think walking is a good thing, less injury prone, brisk walking. Core strengthening is extremely important. Your abs, your glutes, your hamstrings, your quads, your back.
Gym.
The body weight training, basically core strengthening in the gym or with a trainer, with Pilates, whatever, is extremely important, because this goes a long way. How much of a bulk you have, it doesn't help on a long term.
Diabetes. How serious, how to control?
The worst thing that can happen to a person.
Oh.
It's as bad as HIV. It eats you from inside. It just eats you from inside. You won't even know till it strikes you bad. So always and always keep your sugars under control. Low carb diets, which are very, very important. People think it's about eating fat. It's about eating carbs. The more carb you eat, the worse is your profile.
चावल कम खाइए, मीठा कम खाइए. Obesity. Your advice to control obesity.
Low carb diet. Just low carb diet and at least half an hour of walking every day. Exercise, half an hour of exercise every day. Consistency is important. You do 3 hours a day and then after that don't do it for 10 days because you're tired. It doesn't make sense. Do half an hour every day is better than that.
So I have 2 questions. I'll ask both at the same time because you've already answered half of my next questions. One is intermittent fasting, good, bad, or just a fad? South Beach diet, protein diet, zero carb diet, all fat diet. What's a common sense diet?
Common sense diet basically is a low carb, portion controlled diet.
Portion controlled.
See,
right.
You're going to eat all your life.
Yes.
Right? You're going to live along with the current present scenario of the medical situation. Your life expectancy is going to be 80 years, 85 years. Do things which are sustainable over a long period of time. Nothing of what you said is going to be sustainable over a period of time. Intermittent fasting, keto diets are good for rapid loss. People who are in the film industry who actually need to rapidly reduce weight, it's good. But are you going to do that all your life? You're not going to do that all your life. Reduce your carbs. If you look at it, our Indian breakfast, everything is carbs. Your idlis, dosas, puris, vadas, poha, breads, everything is carbs. cut that off, 30% of your carbs in the day is gone. Eat a lot of egg whites, sprouts, fruits. I love what Virat Kohli had once said. He said, exercise I can do. I need to train my mind to eat the same thing every day for the next part of my life. It's unbelievable what he said. And it's true. You need to do certain things on a regular basis just like that. Have a cheat day once in 15 days. Do what you want. You don't have to be a saint, but then these things have to be done.
This conversation is so interesting that I'm asking something which I didn't write. So it may be 21 questions now. Bariatrics. Good, bad?
Good for people who are suffering with weight. Great for people who are suffering with weight. Great for people who are wanting to change their lifestyle, wanting to become fitter, who are on a BiPAP machine because of their obesity, who have uncontrolled sugars because of obesity. It will cure it all. It will just cure it all. And with the kind of technology we have now, it's unbelievable. It's just unbelievable that people just get cured of all this. They live completely normal lives. No sugar, no diabetes, no blood pressure. They're off their BiPAP machines, live a normal, complete normal life. It's not, never do bariatrics for cosmetics. It's for people who are suffering with weight.
What is estrogen? What role does it play? Why is it significant?
Estrogen is a female hormone which is there even in men but at lower levels. It is a natural protector because it increases the good cholesterol, reduces the bad cholesterol. And that's why at one point in time it was when we studied that females are not prone for cardiac disease before menopause. They are more prone for, that's when the estrogen comes down. But now with the metrosexual lives we are living, with everybody smoking, everybody drinking alcohol, the pollution, the stress levels of women are equal to men. We live equal lives now. That risk factors is negated now. So it's even women at younger ages now develop cardiac issues. They develop cardiac issues equally and actually they get worse disease because of the physical structure is smaller. I'm not being sexist here, but that's the way nature is, so that's the way it is.
Maybe you've answered my next question already, but I'll ask you again. 3 best tips for cardiovascular fitness. Just 3.
Regular exercise, low carb diet and proper sleep.
Regular exercise, low carb diet, proper sleep. Likh lijiye. Fantastic. My next question. COVID. How badly has it affected all of us? How to build our immunity? Because these are 2 questions. How to build our immunity so if something like this may not be called COVID resurfaces again, we are prepared.
It's the same 3 things. Control your weight. Control your weight, regular exercise, live a controlled life. I'm not saying that will make you immune to COVID. COVID was the largest disaster probably after World War II. That is how bad it has hit entire humanity. It's not us or me or you or this family or that family, it's the entire humanity that has been hit. And it was one of the most heart-rending thing that's ever happened because we have seen the worst of what we saw when we were treating them. So it was bad.
I'm asking a personal question for myself. I drink a lot of water, even during winter. Good, bad?
Good, great, amazing.
So how much water?
No wonder the charm is still there.
Thank you. But I do suffer from acidity. So again, a personal question. Not really too much, but how does one control acidity? कोई दादी का नुस्खा है इसके लिए?
दादी का नुस्खा is jeera water.
Okay.
Yeah, but otherwise I think it's about eating on time and eating the right things and a good sleep. Regularity of your meals. So it has to be 8. If it's 8, 2 and 8, it has to be 8, 2 and 8 every day. It can't be 5, 6, 12. One off day is fine, but not on a regular basis.
Okay. Now I'm coming to a little serious type of questions. How to differentiate between heart attack and acidity?
Even God can't. Trust me on that. 30% of people who walk into our hospital with the symptoms saying they have acidity and gas is actually a heart attack. And it's so difficult to convince them that you're actually suffering from something which is life-threatening. See, I'll tell you a very simple way. If you have not suffered from a kind of pain that you're suffering ever in your life, or the kind of chest burning that you've ever had, never had such a chest burning, it is a cardiac issue. It cannot be a gastric issue. If you have gotten up from your sleep with a chest pain, it is a cardiac issue. It is never acidity that will make you get up in the morning.
Right.
So these are things that, or if you're walking and you're needing to stop because you feel that your chest is getting heavy, you have a cardiac issue, please get yourself treated. These are early signs which will save your life.
So, another very delicate question, but very important for all those who are watching this episode. If someone around us at home or outside gives symptoms of heart attack like you spoke, what are the next steps we should take?
First thing, let them not walk, let them not climb stairs or go down the stair, which is the first thing that we generally do. First, let them lie down, give them dissolve an Disprin, the old Disprin, because the Ecosprin basically is enteric coated, so you cannot dissolve it. The aspirin gets absorbed from the buccal mucosa. So if you dissolve it in water and actually let them drink, it will get absorbed quicker.
How much time can we give this?
As soon as possible. It will immediately start acting in the next 5 minutes.
Okay.
So that's the first thing that you do. Hold the pulse. See if the pulse is nice and bounding. Give him a sorbitrate under his tongue, the sublingual, which will get dissolved. Will at least give us that amount of time to take him to the hospital. Call the ambulance. Ambulance services are better than earlier, but then call the ambulance and rush to the nearest hospital.
Okay. Now, can you tell us what is the difference between open heart and bypass surgery?
So, open heart is a common man's term, basically. You don't open the heart for a bypass surgery. Ke liye you don't open the heart.
Right.
It's the arteries are above the heart, so you just graft the vessels above the heart. You open the heart when you're changing the valve, when you're changing. So that's when you actually go on to a pump now.
You don't do open hearts?
No, I don't do open hearts. I do stents. I do replace percutaneous valves, pacemakers.
So my next question is a very different type. Talking of hearts, कोई लोग बोलते हैं यार इसका दिल बहुत बड़ा है, बहुत दिलदार है. कोई बोलता है यार ये छोटा दिल है, मुर्गी दिल है इसका. I mean, why did this saying come about? Does it have any relation? And on the physiological side, what should be the size of a heart?
It's a figure of speech. I think it's related to the bank account, not to the heart. It's upon how much a person is able to give away the money that they have. That's all.
Steroids. When are steroids necessary?
It's a necessary devil. So when you need it, there's no replacement for it. Unnecessarily, it can be a disaster to your body. It has its own side effects. But then when necessary, it needs to be given. I don't want to get into the different causes of it, but then there are multiple causes where you actually need steroids and they are life-saving. But certain places, it's just prescribed because it will reduce the symptoms of the thing, but that is not the way steroids should be prescribed. Steroids should not be given over the counter.
Speaking of prescription, my last question, I think, if you go abroad, barring maybe a paracetamol, कुछ नहीं मिलता है. India में कुछ भी ले लो without any prescription. Why is this trend going on? At least in Hyderabad, I don't know the rest of the country. What should be done to stop all this?
Government is getting better on that. There are a lot of things where government has now been pretty stringent on. But yes, we do get a lot of medication on the go, which is not good because a lot of dangerous drugs are prescribed. Luckily now at least sedatives and all those things are now being regulated. But there's still a lot of antibiotics that are given on over the counter. There are a lot of other medications which is not good actually. It's not good.
So viewers, now that you know so much about Dr. Anuj Kapadiya and about his views on health, still I want to know a little more. I'm sure you want to do the same. तो सर हैदराबादी में कुछ सवाल पूछता हूँ. Hippocratic oath. कई लोग बोलते हैं Hippocratic oath. क्या ये सही है? How many doctors actually follow that oath?
See, I will tell you, barring a few things which I think are there in every profession, I don't see any doctors who want to harm anybody.
Right.
There is a cost to medicine which is there, which is based on a lot of things. You need to provide, so when you need to provide, you need money. And when you need money, you need money. How do you sustain something without it, right? It's not possible. So I have worked in a government setup. I know how much is available. Versus I've worked in the best of corporate now. So I know what is available and the difference that you can make. So certain things you need money, I understand. But I don't see people, I have not seen people who say, let's harm him to make money. I have not seen that. Let me be very frank. I am not being biased over here. Lack of knowledge is, yes, there, I understand, which can harm a lot of people. But then wantingly just to make money out of somebody, I don't think things are done bad. A lot of people may beg to differ, but then if you go and interact with the doctor there, because see, you may have a pain in the chest, I may have a pain in the chest, there may be different reasons for it. I need to investigate that. I just can't go on a blanket thing and say, oh, this is this, because you had this, I will have this. No, right? So for that you need to investigate that costs and all these things happen. But I think most of them are true to their profession.
अभी जो let us talk of 3-tier cities, rural India, क्या आपको लगता है कि the medical facility is sufficient there?
No, it's not. Governments are getting better, especially the Telangana government is doing a great job with medicine now. The district hospitals have become unbelievably amazing, especially the mother and child. They're doing a superb job. And in fact, they are shared better than a lot of private hospitals in those areas. And they have all the specialists, all the required equipment and investigations there. So that way it's reduced the mortality of maternal mortality, the pediatric mortality is significantly. Overall the whole country, no, not yet. I don't want to go into the village, right?
Right.
So the same thing with anybody else.
हर country में government provides for medical insurance. हम लोग यहाँ पे पैसे दे दे के medical insurance खरीदते हैं. कुछ किया जा सकता है इसके बारे में? गरीब का,
we all need to pay our taxes better. So there is no black there, right? We have a parallel budget here. Government is still doing it. Government still has Arogyasri. The governments are doing a lot in terms of providing free medicine, medical facility, and they are doing a great job with that. A lot of poor people are actually benefiting from it. Arogyasri, which was started in Telangana actually, has been adopted by most of the country.
Is it?
Oh yeah, and I have done, being in Usmania at that point in time, so much help to people. Free of cost. That's borne by the government for the people who are below poverty line. It was an amazing thing that was taken, and it's still continuing. They're doing a great job even now. So that way they're providing. It's not, but our population is so much. Rich people don't want to part away from their money. How will it work?
So moving away from 3-tier to the metros, there is so much of medical tourism right now in the country. My question, I'll divide it into 2 parts. What is the future of medical tourism? And dusra, how does Indian medical facility compare globally?
You want a truthful answer for this?
Yes.
We are better than US in terms of accessibility to doctors. I'm being very, very open and frank on this. We are better than the British with the NHS. Right now, the present trend is people from the US, especially the doctors in US, even if their parents are there, they bring their parents here, get them checked completely and then go back, because it would take them 5 months for them to get an appointment for things. An MRI takes 2 months to get an appointment. I can walk into any place today, even on a Sunday afternoon, and get an MRI done. That is the best part of things, with the best of opinions that we need. We have more experience because of the number of people that we have who are ill. And if you look at it, the American system, if you get all the doctors out of, Indian doctors out of the American system, their system will collapse. Same thing with the UK system as well. That's how well penetrated an Indian medical facility is right now. We are better than most, lesser than none. I proudly say that. And it's not about me, I'm saying the whole Indian fraternity of doctors, we are much, much better than most of them.
You said that given our pollution and population increase, I'm relating that to whatever you said earlier, कि आपको लगता है कि we'll sometime going ahead, we'll have a shortage of doctors in this country?
No, No, I don't think so. We're having enough there is not a shortage of doctors. You have enough and more doctors. Problem is the distribution of doctors between rural and urban India.
I see.
You have dime a dozen doctors there. You don't have a problem with that. Problem is with the distribution of doctors between urban and rural, which is now they are trying to equate it and get it better. But that's the problem. It's not the number of doctors being less.
Anuj, we are coming to the end of this interview. I'll ask you another 2 or 3 questions. Actually, I want to ask you 20 more, but thank you so much. I'll begin winding off. So maybe with just 2 or 3 questions. One is, you have won a lot of recognitions, a lot of awards. Can you tell us what has been most satisfying in that sphere?
So, for me, the most if you ask me, as you are asking me this question, what I remembered, I'll tell you. So, the best thing that I could do is to revive my teacher who came into the hospital with a cardiac arrest. No award can actually equate to that.
Right.
I jumped onto the trolley, did a CPR on him, took him into the Cathlab. He came with a standstill heart and revived him. And today also he is teaching after 14 years.
Wow.
So that was the best Guru Dakshina I could ever give. I became a cardiologist looking at him as a cardiologist. I don't want to name him, but then yeah, that's what it is.
In terms of
the best award, if you ask me, he stood up in the middle of conference in Guntur, a state conference in Guntur, where I was also there. I was chairing a session, and he pointed out to me and asked me to stand up and said, "This man is the man who saved my life." So nothing was better.
No amount of money can equate that. Yes.
Me, yeah.
And about the medals you received, anything specific?
Doesn't matter.
Doesn't matter. So any mentor you have in your life?
I won't say mentor, but I still fall back on a couple of people called Dr. Bipin Sethi, who was an endocrinologist in Care Hospital, a senior endocrinologist, and Dr. Rauf is a urologist. I fall back on them when I need advice. I don't have anybody in the house, in the family who's a doctor. I'm the first one. And for me, those are the 2 people I look back and go back to speak to in case I need to discuss.
My last question, the last. Stress is eating up this world. I don't think I know anyone these days who doesn't live by the word stress. So give us 3 do's and don'ts in our lives or health, whatever. I know you've already said those 3 words again and again. I want one last time, 3 do's and 3 don'ts to kill stress.
Do's: 1, spend a lot of time with your family, sleep properly and exercise. And I would probably say one more thing, do the thing in your life which you enjoy.
That could kill stress, yes.
So that's one thing that I would say. Don't, 1, please don't smoke. 2nd, don't live by your targets because you have a lifetime to achieve them. And 3, don't get into petty things that don't matter.
Wow, that was truly wonderful, Dr. Anuj. I'm extremely delighted that I could spend some time with you. I wish I could ask you another 30 questions and maybe I'll prepare another list and come back again, especially for a rapid fire. I learned so much today. Thank you so much.
Thank you so much. Thanks.
Whether this city has grown up on me or I have grown up in this city, kya farak padta hai yaar. See you soon upon Hyderabadi. Thank you.